Hello, everybody. Welcome back. One of the friends recently asked me about leg swelling. So this is a very important topic. This is a very common condition seen in a lot of people. Um, what I mean to say is a lot of people have this problem of leg swelling, swelling in the ankles, lower part of the legs, and the feet. um, so there are like numerous causes. I'll go over some of them. I don't think one video is enough for this, but I'll be very brief initially. In the future videos, we can make more detailed explanation of each condition. Basically, leg swelling can present either in one leg or two legs. Let's first talk about one leg swelling. If there is swelling in only one side, either in the ankle, foot, or lower part of the legs, obviously there are too many causes, but a few of them, which are more dangerous ones, we'll talk. Like if somebody gets some injury, something fell on their feet or foot, it can swell, and it's very easy to know. Everybody knows what it is. But if there is swelling in the calf muscle, the muscle just below the knee on the back of the leg, if that hurts and you notice swelling in the one leg more than the two, then it could be blood clots. I don't know if it is very common in India, but here it is common, especially if someone had a recent surgery or a recent injury to the leg, and the person is not using the leg. That means he's not as he used to be. If somebody is taking bed rest for a long time, just sitting at home for a few weeks, not doing much, so in those people the blood can clot. That leads to swelling in the legs, and it hurts when you move. It's prominent in the calf muscle, the muscle below the knee on the posterior, on the back side. That's one of the causes, and the blood clots are obviously dangerous, so you have to take care of it. You have to see the doctor in that case. The second cause is cellulitis or infection. Um, when somebody has a trauma, especially in the people with diabetes, if there's a small trauma, you got a skin cut either in the leg or in the foot below in the sole, the infection can spread to the leg, lower part of the leg. If you don't treat it, it gets worse and worse, and obviously that person needs antibiotic treatment and they have to see the doctor. This usually happens in only one leg. The other thing is arthritis. If somebody has especially what is called gouty arthritis, it happens usually in only the great toe, the big toe, on the first joint between the foot and the great toe. That can cause swelling in that foot. That is one-sided swelling usually. um, what else on the top of my brain? These are some of the most common conditions we see in the hospital setting. There are a few more. I don't want to put too many, but let us go to the swelling in both the legs. There are some conditions where the legs can swell in both of them, and this is kind of a little bit more dangerous. The blood clots in the leg are definitely dangerous, but there are other causes which cause swelling in both the legs. One by one, let's take one by one. First one is heart failure. So if somebody has diabetes, high blood pressure, if they had a heart attack, whether they knew about it or not, some people can have heart attack without their knowledge. Especially those diabetics, they may have small heart attack, but they won't even feel it because they don't feel the pain sometimes if it is small one. So their heart slowly becomes weak. If they have blockages in the blood vessels supplying blood to the heart doesn't function as strongly as it should otherwise. So in those patients, the heart becomes kind of weak, and when you do an echocardiogram, it will show if the heart is weak or not. So usually that causes the circulation failure. The blood in the body doesn't move as smoothly as it should. So in those people, it can cause swelling in both the legs. The swelling starts lower in the feet. It slowly climbs up into the ankles, in the legs, in the thighs, in the lower part of the belly, into the stomach, and into the lungs, and they just can't breathe anymore. So they will have severe shortness of breath, and sometimes they may have to be brought to the emergency room in the middle of the night. So if somebody has leg swelling and it's just getting worse and worse day by day, time to get to the doctor immediately. Okay. Usually they get water pill. It's a pill that will make them make more urine and get rid of the excess water. All that swelling is because of the water. Basically, the body is unable to make more urine, resulting in accumulation of water in the body. And if it is due to the heart, it's called heart failure. So even if the people have a kidney failure, so with especially in people with diabetes or people who are taking these painkillers online on the over the counter, like NSAIDs, something like ibuprofen, we call here Motrin, or in India what we call uh, we have Toradol, any pill that is made to control the pain, which come under non-steroidal anti-inflammatory drugs. They can cause kidney damage, or even diabetes slowly can damage the kidneys, resulting in lower function. Low kidney function means kidneys unable to make urine as much as it used to in the past. So the urine, the impurities get accumulated in the body, and the water is not able to be removed from the body in the form of urine. So they start swelling up, and that swelling can cause can occur in both the legs at that time. So obviously we have to see what is causing the problem. If it is diabetes, control the diabetes better. Stop using these painkillers over the counter. If you go to Walmart, CVS, pharmacy, or Rite Aid, just don't buy any painkiller just like that and start using it. If you have a headache, if you have some pain somewhere chronically, like long time, don't medicate yourself. If you use Tylenol, kind of safe, but anything more than that, not at all safe. So you definitely have to make sure you're not over to taking those pills too much. The other can be liver failure. Um, Liver failure causes swelling in the legs, and also it can also cause a swelling in the entire body. For those people who drink a lot of alcohol, with time it will cause inflammation in the liver, and that causes fibrosis. The liver doesn't allow the blood to flow smoothly, so the swelling in the legs will occur. And those people also need water pills. It's called Lasix or furosemide. There are a few of them. I won't go into details, but they also need diuretics. So prevention is better than cure. So don't drink too much. Little bit is okay. I'm not endorsing anything, but I'm just telling. And next, coming to the some of the medical problems which are a little bit more serious, not very common. There are some multiple myeloma which can cause entire body swelling. There are a few other, like patient not eating well, so they have low protein in the body, so they can also swell up everywhere. They're swollen up. They look big, but they're very weak. Yes, there's no muscle mass, or they're just weak because they are not doing well. So some of these medical conditions. Okay, I forgot to mention one very important thing in the one side swelling of the legs, that is for engineers, especially working in the US. When they sit the whole day or most of the day in front of the computer, they fold one of the legs and put it under their butt and sit while they're sitting in the chair, or they just fold it while sitting on the sofa, just to feel comfortable with a laptop on the lap. In those people, especially if they're wearing tight pants, the blood circulation won't be good, so they start swelling up in the ankles, and that can actually give a lot of pain. So I know one of my family members who had swelling in the ankle, and all that we needed was just tell him, don't fold your leg like that anymore. And for most of these leg swelling, so the first thing is try to know what is causing the problem. We have to treat them perfectly, the right treatment. Otherwise you won't know. You will go around, you'll do a lot of medication trials and nothing works unless you know the exact problem. So that's why it's very important that everybody has a PCP, we call primary care provider or primary care physician, where you go every year. Make sure, even though you're doing perfectly normal, you feel like you're doing absolutely wonderful, you still go and get yourself checked. Okay, one of my friends, he's very healthy, but he was just going and every year get blood work just to make sure he's okay. He was noted to have hemoglobin dropping slowly. So at the end of the day, when everything was checked as to why he is having drop in the hemoglobin, that is blood count, it was known that he has a hypothyroidism. So when it was corrected, his blood counts were normal later. So it's very important. Even if you feel perfectly normal, go to the doctor, tell what pills you're taking at home, even if it is like over the counter or herbal medications or homeopathy, whatever medication you're taking, just tell exactly what you're doing at home. Get yourself checked, let the doctor look into all these details, and you're good to go. So these are some of the things I wanted to tell. And the one thing I want to tell, you might have heard people saying drink a lot of water because that is good for health. Just that you heard that, don't go to your parents and say, hey dad or mom, I drink a lot of water because it's good for health. Because some of these heart failure patients or patients who are getting swelling is nothing, most of the times swelling is nothing other than water. Unless somebody has infection, that's swelling, or there is some trauma that is so swelling, it's different. But these swellings from heart failure, liver failure, kidney failure, and some other condition called hyponatremia, that is low sodium level in the blood, these patients, they're not supposed to drink as much as they want. So don't go to your parents and say, oh, you got to drink more water. Your parent is complaining, I have swelling in the legs, I'm feeling short of breath. Oh dad, you are not drinking enough water, that's why you have all these problems. I mean, there are people who say that. I mean, I'm telling you, this happened. So you got to be careful what you suggest to your parents. Always take the advice from a medical doctor. Okay. So I hope you like the video. In future, I'm going to explain more and more conditions. Please like and share these videos. See you next time.